Welcome, everyone, to the Minneapolis Public Health Community Institute. This is one of the trainings for the Public Health Community Institute core competencies. Today, we're diving into an essential topic, budgeting for success. This session is designed to help us enhance our understanding of budgeting requirements and processes specifically tailored for public health projects. We'll also focus on building your skills and confidence in managing budgets, which is crucial for the success of any initiative. Finally, we aim to strengthen community engagement by fostering collaboration and shared learning. As we progress, keep in mind how budgeting connects to our broader goals in public health. When you tell the story of your project, you can shape the budget to enhance and support your project goals. Thank you, and let's get started. First of all, my name is Patrick Jones. I'm the Director of Finance for Advocates for Better Health. Advocates for Better Health is committed to supporting and equipping and connecting various advocates to promote health equity in Minnesota. Our mission is to foster a healthy, equitable, and thriving state by backing public health initiatives that are informed by the community and developed in collaboration with health professionals. Today, we're going to focus on three key objectives to improve budgeting in public health projects. Better understand budgeting requirements and the budgeting process for public health initiatives. Help you feel more confident about managing budgets effectively. And strengthen our community collaboration and learning through inclusive planning. These objectives will guide our discussions and help us advocate for better health. Let's get started. Your budget is a statement of values and a way to tell your story. Successful budgeting doesn't just happen, it requires thoughtful planning and attention to detail. Here's how we recommend approaching it. First of all, start the budget process early. Don't save it for last. It should never be an afterthought. It's key that you identify true program costs, including labor, materials, and any in-kind support. Accurately estimate your expenses. Be thorough and realistic. Also, accurately estimate your income. Think about grants, donations, and other revenue streams that will also support your project that you can show and demonstrate. Carefully review the budget to ensure accuracy and completeness. Make sure you secure approval from your staff and your board. Document everything clearly. Written records make budgets easier to manage and track. And finally, put your budget into action and monitor the progress regularly. And remember, budgeting isn't a one and done. It should be an ongoing process throughout the project. You should check monthly to see the spend down, even if you have a bookkeeper. And remember, your program person is responsible for the spending. Reconcile spending and revenue from your accounting system with a grant tracker, which is a resource we'll provide. So do you need one? And you should also be actively engaged in how the money is going out the door. You can use our work process as an example as we coach you. Stick to the spending plan, making adjustments to the revenue or expenses as they change. And finally, talk to your program officer throughout the project in case anything does change and you need to adjust. Under this CDC grant to the city of Minneapolis, certain expenses are disallowed. You cannot budget for food or refreshments for events or for gift cards for participants. Some expense areas to consider are labor. This is typically the biggest expense for any project, and it's for a reason. Projects don't succeed without the effort of you and your staff, so pay yourself and your people. Supplies are anything that is needed for the project, like writing or display materials, event supplies, and so on. If you need equipment, please budget for it. We can discuss and evaluate the needs during your coaching sessions. For events, estimate a realistic venue rental cost. If your staff or you has to drive and pay for parking, reimburse them by budgeting for it in mileage and parking expenses. And then finally, you should have liability insurance put into the budget if you don't already have it. Here are the minimum insurance requirements. Insurance can be tricky, but it's essential for protecting your organization, and the city of Minneapolis requires it to fund your project. Here's an overview of the requirements you'll need to meet. For general liability insurance, you should have coverage of at least 1 million per occurrence and 2 million aggregate. It must include bodily injury, property damage, personal injury, advertising injury, fire, legal liability, and completed operations. And advocates for better health should be listed as an additional insured. For automobility liability, the coverage should apply to all owned, leased, or hired vehicles that are engaged in the project. At least 1 million combined liability limit per occurrence. And again, advocates for better health should be listed as an additional insured. And finally, workers' compensation and employers' liability. You should have coverage according to the statutory requirements. An employer's liability with minimum limits as specified, 100, 500, and 100K. And a proper documentation via certificate insurance is required. In addition to budgeting tools, consider other supports your organizations might need that we will provide, such as common items needed for requests for proposals or contracts, help or guidance on becoming an approved e-supplier with the City of Minneapolis, and insights into funders' operations and how to secure revenue through grants and other sources. Becky and myself are available to assist you with navigating these resources, so feel free to reach out. If you have the capacity, when you upload your application, upload the full budget. Otherwise, please provide an estimate of funds needed. We will work with you on getting that shaped into a program budget during coaching. And remember, we want the true cost of the project without padding. Don't forget to include in-kind donations of volunteer time and materials. This shows funders that you have support. As we wrap up, just remember we're part of your big idea team, and we are dedicated to helping you achieve success in your public health initiatives. So let's quickly recap our session. We learned budgeting essentials for public health programs. We reviewed tools and resources to streamline your budgeting process, and we clarified important insurance and compliance requirements. Before applying, all applicants must participate in the 4 competency trainings and 2 additional trainings. This training is the 4th core competency training in the PHCI series. Once you've completed the entire training, complete an online knowledge check at the link below this video. Thank you again for joining this training, and keep advocating for better health.